The Kaiser Family Foundation presents health08.org, election news, analysis, and events.
Dr. Jenkins, thanks for coming in today.
Thank you for inviting me.
Appreciate it. In the Academy's view, what is the single most significant problem in the healthcare system today?
I think the Academy for several years has really been concerned most about access to care for children. And, you know, we were big supporters of SCHIP, and we were able to, in the pediatric area, show the benefits of getting more kids covered in terms of the children who got routine primary care. As a result, some of the disparities in health that we saw with African American and Latino children were corrected when they got access to care. So we are really concerned about getting all children covered. We really think that, you know, health insurance and health coverage should be a right for children in this country.
And what's the means by which the Academy believes all children should be covered?
The Academy right now has a bill that it's had before Congress called Medikids, and that's sort of our showcase for what we think ought to happen. But we also recognize that Congress is very unlikely to pick up someone's bill and pass it. So we've sort of put together what we consider our universal principles for whatever bill is finally put together, that they consider these issues for children. And I think we're looking at the portability, so that when families move either across the state or the parent changes jobs, they don't have this hiatus in between the job that they lose their coverage. We're also concerned about it being a streamlined process so that parents aren't, you know, sort of pushed away by having these long applications to fill out.
Because there are children currently eligible for SCHIP programs who aren't enrolled because of that issue.
Right, exactly. And, you know, there are some states that have gone to a single application for the benefits. And I think in this age of computers, I mean, why don't we have that, you know, with the proper security elements to it? You know, that would really streamline the ability to get more children who are eligible, you know, into programs. We also really know that, you know, our members have told us, you know, we've also got to have reasonable rates, and the rates vary so much by state, and we really look at it in terms of what percentage of Medicare, and we have rates that are very low in some states, and consequently, you know, pediatricians can't afford to take, you know, very many kids into their practice who are Medicaid or SCHIP if they can't get really reimbursed adequately for it.
Do you have any sense of what states are most impacted by what you just described, where physicians, pediatricians cannot, will not accept new children into their practices?
I don't have the specifics, but my impression is the states that are most challenged in terms of enrolling children are states like Texas. Then there are states who do an excellent job like Alabama. And, you know, you would say, but they're neither one of them are really high, you know, income states. What's the difference? And I think the ability to really look at what some states are doing and really understand more about what they have available, because, you know, Medicaid and SCHIP are matching funds. The state has to add funds to the federal dollars that are there. And so I think there are states that have, you know, access to more federal dollars, but they can't come up with state matches for that. So I think states are challenged. I don't think all of it is, you know, the meanness of not wanting to get kids on. I think they're really challenged by the economics of how to, you know, use the matching funds and how to really, you know, absorb these children in a way that won't bankrupt the state's ability to provide health care.
In a general sense, can you tell me what the shortfall is for a pediatrician when they take a child such as the kind that you've just described? They need X number of dollars to make it financially feasible, but they're getting how much?
Right. I think that's a very variable number based on the state they're located in and what type of practice they have. But we've been told by our members that, for example, you know, in some states they can actually lose money if they take a certain number of kids in their Medicaid practice, and you know, a certain number of Medicaid children in their practices, meaning it's not just a break-even issue, it's a loss issue. We have specific issues around vaccines, for example, in terms of administration fees. Adult vaccine providers or people who give vaccines can get, you know, $50 for administration fees. In some states, the administration fees for children are as low as $2 or $5. So we're really talking about really big differences between health professionals who take care of adults and those who take care of children.
You've talked mostly about government-financed programs so far in terms of broadening access to children. What does the Academy see as the role of the private sector in broadening access?
Well, I think, you know, the issue as it's been put out now is affordable, okay? And I think that's the key, that we're really looking to insurers to make sure the family policies are affordable, that it doesn't get to be a decision point for parents, you know, do I take this much home so I can feed my kids, or do I put this much in and anticipate that something could happen? I don't want to protect any sort of catastrophic issue, so I want to get health insurance. And so I think our issues have, on a broad scale, been affordable, more so than they've been more specific. We're also concerned about private payers and having the appropriate benefits packages, so that preventive health is included in that. And so I think that's been really one of our points in terms of looking at private insurance.